As news broke of a massive tornado in central Mississippi on April 24th, the University of Mississippi Medical Center quickly mobilized its staff and responded, dispatching its air care helicopters with nurses and supplies to Yazoo City, Lexington, and other areas of the state devastated by the deadly tornado.
From the crew that we've had come back from the staging area, they were amazed and astounded about the amount of damage, and said it was surrealistic looking.
There were a lot of down power lines, a lot of open gas lines, so getting two people to actually assess their injuries was the biggest issue that was being faced today.
Our triage nurses did a great job in the field, organizing a very difficult situation and triaging the appropriate patients back to us.
And you've seen a variety of injuries today?
Yeah, a variety of injuries, everything from torn eye to fractures, pelvic fractures, and other injuries like that.
Less than 12 hours after the tornado touched down, 27 people had been brought to the medical center by air or ground ambulance or private car. Of those, 8 adults were in critical condition, 13 were in fair condition, and 6 children were in serious condition.
I've been here for plant explosions, train derailments, and previous tornadoes, and the volume of patients that we saw today was only comparable to what we were seeing during Katrina. Katrina was just more sustained. We had this type of volume for many more days, almost a full week, as opposed to what we saw today. But it was very high volume.
The efforts of Smith, Summers, Wilson, and their colleagues at University Medical Center, along with those of other medical first responders in the state, were coordinated by Mississippi MedCom, a high-tech medical communications center created in the wake of Hurricane Katrina.
Many of the transfers right after Katrina were managed on Post-it notes and an easel with a list of ongoing names of patients being transferred in, and had some good folks with some great ideas. They brought MedCom to fruition, and fortunate with the Department of Health HRSA grant funding to establish the infrastructure of MedCom.
And not that you needed proof that it works, but today...
It works. It works every day. It's nice to see it really working on a day like today. This is what we were designed for.
It is a valuable resource, and I guess the big thing is to stress that we have good partnerships with the Department of Health and with MEMA and other state agencies, and we've learned some valuable lessons from Katrina, and today those lessons learned paid off in a better response, and I think that's the key.
Great things I saw today were a lot of agencies come together, a lot of people come together, the people of Yazoo City, Yazoo County, all showing up, and everybody was there. I mean, people were writing volunteer and their name on a name badge and walking around and just trying to help folks.
To learn more about Mississippi MedCom, or the state's only Level 1 Trauma Center at the University of Mississippi Medical Center, go to umc.edu.